Good day. I am Bea Maureen Gementiza from BSN 13D, Group 14, and a student nurse from Davao Doctors College. And today, I will be performing a return demonstration on wound care. So in wound care, the nurse will utilize a variety of techniques that assess, treat, and care for patients with wounds. Also, wound care is necessary to prevent infections and other complications. Lastly, it promotes healing of the skin after scarring. So for the assessment, the first thing to do is to identify the patient using at least 2 identifiers. We're going to identify the patient's name and birthday to verify that we are attending the correct patient. So, good morning, ma'am. Ako si Bea, student nurse from Davao Doctors College. Kabalo man ta magbisaya, ma'am, no? So, ma'am, unsa gani pangalan ug apelyido?
Angela Batang.
Ano sa ang birthday, ma'am? Sige, ma'am. Correct. Thank you, ma'am. So, for the next step is to review order for irrigation and the type of solution to be used. We are doing this to confirm the doctor's order for irrigation and what type of solution that we are going to use to our patient. So, this is the doctor's order to do wound care using a normal saline solution. For the third step, assess patient's level of comfort. Administer analgesic at least 30 minutes before removal. This is to promote patient's comfort, and since wound care can be painful, we can administer analgesic to alleviate patient's pain during the procedure. So, ma'am, kamusta ma'am? Okay lang ba atong paminaw karon or nagangulul ba ang atong samad?
Okay lang man.
So, na-other gi-order si Doc, ma'am, na analgesic ni siya. So, kani siya natambal kay makatabang ni siya para mawala ang pain or ang kasakit during sa removal na to sa or pagtanggal na to sa imuhang kanang dressing, ma'am, kaning nakatabon sa imuhang samad kay since kada siya na procedure, sakit siya. So, ato lang ning inumon, ma'am, ha? Okay lang, ma'am?
Okay lang.
Sige, ma'am, mag-inom ta, ma'am. Step is to review medical record for symptoms related to patient's open wound. This is done for us to have an idea on what to assess on patient's wound. So now we are reviewing the medical record for symptoms of our patient's wound. So we have here patient experiencing pain with the pain scale of 6 out of 10 with characteristic of knowing pain. Fourth step is to review medical record for symptoms related to patient's open wound. This is done for us to have an idea on what to assess on patient's wound. So now we are reviewing the medical record for symptoms of our patient's wound. So we have here patient experiencing pain with pain scale of 6 out of 10 with a characteristic of knowing pain. For history of allergies to antiseptic, medications, tape, or dressing materials. This is to ensure safety for our patient, especially if the patient is using a latex gloves or tape adhesives. So, ma'am, mangutanan lang po, ma'am, ha, kung naa ba kay allergy sa mga dressing, mga tapes, ma'am, na ginatawad sa imuha, na ba allergy, ana? Sa kanang mga gloves, ma'am, like mga latex na gloves, allergy baka ana. Sa mga pagkaon, ma'am, sa mga saging, allergy ka. Sa tambal, ma'am, na ba kay allergy sa mga tambal? Sige, ma'am, ayaw, ma'am. Step 1 is to identify expected outcomes. This is done for us to know the possible outcomes during the procedure and after the procedure. Step 2 is to administer analgesic 30 to 45 minutes before doing the procedure. As I have said a while ago, we are doing this to alleviate patient's pain during the procedure. So, ma'am, maghatag ko og analgesic ha. Inahatag na mo ni siya 30 to 45 minutes before nato buhaton ang paglimpyo sa imong samad, ang pag-remove sa kanat na dressing, o pag-irrigate unya, kay para dili siya sakit, mawala ang iyang sakit. Ma'am ha? So mag-inom lang ta ma'am. Yan na yung palad ma'am. Ako yung pang-hambal. Inom lang ta ma'am. Thank you ma'am. Third step is to educate the patient and the family about the procedure. We are doing this to elicit cooperation for the patient and as well as the family. And of course, to establish rapport. So ma'am, ato ading buhaton karon kay mag-change ta sa imong dressing. Balikaning dressing na to ma'am, tanggalon na to na siya unya. Then ato siyang pasiritan og kanang solution na katong gi-order ni Doc sa tuha, which is tong normal saline solution. Ato siyang paagasan niya ma'am ha, para matanggal tong mga ginatawag nato na exudate or katong mga nana. Then after ana, ato siyang paugahon. Then ato na pud siyang ilisan og bag-o nga dressing ma'am. Then para pud mas okay ang iyang healing process. Okay lang ba ma'am? Sige ma'am. Next is to gather appropriate supplies. Organizing of equipment promotes time management. We have here our normal saline solution. We also have our alcohol, our syringe. This will serve as our kidney basin, our improvised dressing, our ball pen for documentation later on, our tape. Next, we also have our waterproof other pads. We also have this biohazard bag. And of course, we also have the cotton buds for us to get a specimen of the wound that we are going to bring to the laboratory. And of course, our PPE, so composed of our lab gown. We also have our face mask, our face shield, and of course, a gloves. Next is to provide privacy for our patient, perform hand hygiene, and position the patient appropriately. This is done to preserve dignity for our patient, to prevent the spread of microorganisms, and to provide comfort for our patient. So ma'am, sila na ako yung puntahan ma'am ha, para wala'y makakita sa imo. Then para na po tayo privacy. Ma'am, okay lang itong ano ma'am? Position ma'am. Ang kamot ma'am, liit mulmol. Sige ma'am. Next, for the implementation, we need to perform a hand hygiene so that we can prevent the spread of microorganisms. Next is to form a cuff from a waterproof biohazard bag and place it near the bed. This is done to collect waste and of course to prevent spillage from irrigation. Is to apply PPE or the personal protective equipment, use a sterile precaution if needed, and we need to discard our old dressing and gloves. Also to perform hand hygiene first. So we are doing this to prevent the spread of microorganisms. So this will be our lab gown. So for the return demonstration purposes, I will just remove my my face mask and my face shield so that I can explain to you clearly. Next is to apply clean gloves and perform a wound assessment. So in performing wound assessment, we can follow the mnemonic COCA. We will watch for the color, odor, for the consistency, and the amount of drainage. So since we already apply a clean gloves, we can proceed for the wound assessment. So ma'am, pwede ba nakubulitan? Sakit ba siya ma'am? Ma'am, i-remove lang na ko ma'am ha. Tanggalon na to ma'am ha. Okay lang ba ma'am? So, as you can see, there's a bleeding and the color is red. So, after that, we need to assess the dressing if we can see a slight bleeding. So, after that, we can throw it in this biohazard bag and properly dispose it, and you can remove also your gloves and perform hand hygiene. Is to expose the area near the wound only. This is to preserve dignity to our patient and to provide for privacy. So ma'am, tabunan lang tika diri ma'am ha. Then, kanilang atong samad nimo ang atong i-expose. Step 6 is to irrigate wound with wide opening. Fill the syringe with irrigation solution. So, there are different kinds of irrigation solution that we can use in this procedure. We have the nasal saline. We also have the lactated ringer or antibiotic solutions. So, ma'am, magkuhan ko ma'am ha, magbutang lang ko aming waterproof na underpad sa pangdapit. Comfortable ka dali ma'am? Okay ra ma'am? Then, atay kidney basin. Ibutang na to dali mong kamang ma'am ha. Kay para, unya, dali lang ni salod ang katong mga solusyon na ato ang i-irrigate sa inyo saman. Okay raman ma'am, no? This is to fill in the syringe with a normal saline solution. This is from the doctor's order. Next is to attach a 19-gauge angio catheter. So this will allow to provide an approximately 15 psi of pressure used to irrigate the wound of our patient. So assuming that this is the angio catheter, since we don't have any at all, then we just have to assume. So, ma'am, mag-irrigate na ko, ma'am, ha? Okay lang, ma'am? Sige, relax lang, ma'am, ha? So, continuous lang ang flow. And assuming na meron tayong catheter. Okay lang ba, ma'am? Next is to hold the syringe tip above upper area and under the area being cleansed. So, in cleansing, you have to clean from the least contaminated to the most contaminated area so that it will prevent contamination to the patient's wound site. Also, to flush the wound with a continuous pressure until the solution draining will clear. So this is done to continuously irrigate and flush the wound, and of course to remove the exudate. Ma'am, ano ko ma'am ha? Sakit ma'am? Number 7 is to irrigate deep wound with small opening. Attach a soft catheter to fill the syringe. This is done to facilitate access in small opening in flushing of wounds. Next is to insert tip of the catheter into opening and to flush the wound with a slow and continuous flow. This is done to prevent splushing during the irrigation. Next is to pinch off catheter below syringe while in place. This is done to secure that the catheter is in place while irrigation. Next is to remove and refill the syringe, reconnect to catheter, and repeat until the solution will be clear. Number 8 is to apply clean gloves, cleanse the wound with handheld shower. Also, to perform hand hygiene, apply clean gloves, adjust spray while the patient is seated, and to ensure that the water is warm. We have to ensure that the patient is seated for the patient to prevent slips and falls. Also, we need to make sure that the water is warm to facilitate proper irrigation and removal of exudates. We are also doing this to prevent cross-contamination. So karon ma mag-shower na ta sa imong samad. So comfortable ba ta dira ma? Maglingkod lang ta ma'am ha. Kay para dili ka ma-slide ma'am. So i-on na akong shower ma'am ha. Ma'am paki-check daw ko ma'am be kung tama ra ba ang kainit. Sige daw ma'am, support lang ato diri ma'am kamo. Tama ra ba ang kainit ma'am? Sige ma'am. Next is to shower 5 to 10 minutes. This allow adequate time to cleanse and irrigate the wound.
You got the kick.
this will provide sample for the laboratory for further analysis. So, karon ma'am, magkuha kog sample sa imong samad ma'am ha. Magkuha kog sample kay padala na to siya sa laboratory kay para mabala na to if nabay mga infection or other complications sa nasa imong samad, and mabalan ko na to ma'am kung paayuhan na ni siya. So, ano ko ma'am? Sige ma'am, salamat. Next is to dry the patient's wound with gauze and dry the patient. This will prevent for further irritation of the patient's skin. Ang paugahon na nato ang imong samad ma'am ha, since nahuman naman taog limpyo, paugahon na to siya para dili mag-irritate ang imong skin. So assuming that this is a gauze, sakit ma'am. Then we have to dispose it properly into the biohazard bag. 11. Apply an appropriate dressing and label it with time, date, and student's initial. This is done to record when is the dressing is done for change. So karon ma'am, mag-change na taog dressing sa imong samad. So ato na siyang tabun ma'am para mas maayo ang iyang healing process ma'am, no? So this is my improvised dressing. Tangan ako ma'am ha. Ma'am, pahawid ko diri ma'am. So now magbutang na tag-tape ma'am. Label ako diri oras ma'am ha o petsa kung ano sa kanina human ang dressing. So January 31, 2022. So 5 PM. Then magpirma lang ko ma'am ha on finish siya. Okay ma'am, salamat kay ma'am ha. Next is to remove the face shield, your mask, and the gum. This is to prevent the spread of microorganisms. Is to dispose equipment and soiled supplies. Remove gloves, and of course to perform hand hygiene. So again, this is to prevent the spread of the microorganism. So ma'am, pauna na kami ha. Ma'am, pauna kami. So we will remove our gloves, dispose it properly, and we need to perform hand hygiene. So for the evaluation, step 1, have patient rate level of comfort. This is done to assess the level of comfort of our patient after the procedure. And also, this is to allow you to identify further problems or needs of the patient. So, ma'am, kamusta itong ibati karon ma'am? So, arang-arang naman ma'am, no? Kasi paminaw ni mo ma'am, kamusta ang imong kamot? Ang imong samad ma'am, mulmul ba siya? Sige ma'am. Number 2 is to monitor type of tissue improvement. So this is to evaluate the status of wound and especially the epithelial tissue seen in the wound signifies that it is a healing wound. So, ma'am, kaganina sa itong paglimpyo, gunato ma'am, sa nakita na ko ma'am kay murag padumungay na gid maayo yung sabad, murag mga isa ka semana na lang gid ma'am, maayo na ni siya. Number 3 is to inspect dressing once every shift or as ordered. This is done to assess the drainage or the need to change the dressing. So, ma'am, magbalik ko niya ma'am ha, pagkahuman sa kong shift or basi gusto ni doc na every 4 hours so magbalik ko niya ma'am ha. Kay para i-check na ko ang imuhang samad, unya i-check ko na ko ang dressing kung naapay tugo or kung kailangan ba na ito i-isdan. Ha? Evaluate the peri-wound skin integrity. So this is done to assess the surrounding or the skin surrounded by the wound because frequent application or removal of the adhesive tape can cause damage to the skin surrounded by the wound. So, ma'am, i-check na to ang gilid sa inyong kanang samad, ma'am ha, dapit sa wound. Gina-check na to ni ma'am, kay kasagaran manggod ka na pagtanggal sa mga tape, ma'am ba, or napatay mag-ina-apply, kay mag-irritate siya, ma'am. So, ato i-check, ma'am ha. So, wala man nun, ma'am. So far, okay man nun siya. Number 5 is to observe for the presence of retained irrigants. So, to make sure that all irrigants are dried off and removed in order to prevent skin irritation. So, ma'am, check lang ako ma'am ha, if napabay mga solusyon na bilin or nagbasa-basa. Wala man noon ma'am. So far, uga mapod noon. Step 1 is to record procedure performed and all findings in the patient's chart. So this is done to record an accurate documentation and implementations on the interventions that we have made. So far, the recording wound care is done. So, around 8 a.m. siya, kaganin ng buntag. So, for findings, we have seen wound bleeding, kay present siya kay patient. Then, wala man o nag-complain si patient for pain during the procedure. Step 2 is to report to the healthcare provider any evidence of fresh bleeding, sharp increase of pain, tension of irrigation, and signs of shock immediately. So, to be able to continue providing a wound care to the patient. So, ma'am, nagasakit pa ba, ma'am? Ma'am, if magsakit, ma'am, then ina lang ko dahil, ma'am, ha? Pwede ko nimo tawagan dito sa nurse station para ma-inform na ko dayon si doc kung matagaan kag mga tambal na para mawala ang sakit mo. Okay lang ba, ma'am? So, that's the end of my return demonstration for wound care.